Hi and welcome back to another video of Medic Notes. This video is on laryngomalacia. Laryngomalacia is a medical condition that primarily affects infants and young children. It is a congenital abnormality of the larynx, which is the structure in the throat that contains the vocal cords. Laryngomalacia is characterized by the softening of the tissues of the larynx, particularly the cartilage structures, causing them to collapse during inhalation. The picture shows a normal larynx, where the breathing will be quiet, versus a floppy larynx in laryngomalacia, where there will be noisy breathing. For its etiology, laryngomalacia is due to exaggerated collapse of the glottic structures, especially the epiglottis and arytenoid cartilages, during inspiration. It is the most common cause of stridor in infants. It may be due to decreased muscular tone of the larynx and surrounding structures, or to immature cartilaginous structures. It usually does not result in significant respiratory distress, but occasionally it is severe enough to cause apnea, hypoventilation, hypoxemia, and difficulty feeding. The primary sign of laryngomalacia is inspiratory stridor with little or no expiratory component. The stridor is typically loudest when the infant is feeding or active, and decreases when the infant is relaxed or placed prone, or when the neck is flexed. Any condition that increases upper airway inflammation will exacerbate laryngomalacia, including viral respiratory infections, dysphagia, and gastroesophageal reflux. Laryngomalacia normally peaks by 3 to 5 months of age, and resolves between 6 and 12 months of age. However, occasionally it can persist in otherwise normal children up until 24 months of age, and even longer in children with underlying conditions, especially those with neurological diseases affecting control of upper airway muscles, such as cerebral palsy. Other signs and symptoms include difficulty feeding. Some infants with laryngomalacia may have difficulty with feeding, due to breathing difficulties during nursing or bottle feeding. Gastroesophageal reflux. Laryngomalacia can be associated with GERD, which can further complicate feeding and contribute to the child's discomfort. And also slow weight gain. Infants with severe laryngomalacia may have trouble gaining weight due to feeding difficulties. For diagnostic studies, in many infants with presumed laryngomalacia, the diagnosis can be tentatively established by history and physical examination. If the patient follows the typical course for laryngomalacia, then no further workup is necessary. However, to firmly establish the diagnosis, which is important in more severe or atypical cases, the patient should undergo flexible nasopharyngoscopy to assess the patency and dynamic movement of the larynx and surrounding structures. This procedure can also identify vocal cord abnormalities and airway lesions above the vocal cords. For treatment, in most cases, no therapy is required for laryngomalacia. The infant should be observed closely during times of respiratory infection, for evidence of respiratory compromise. Infants with severe laryngomalacia resulting in hypoventilation, hypoxia, or growth failure, may benefit from a surgical procedure called aryepiglotoplasty, or in extreme cases, a tracheostomy to bypass the upper airway. That's all for this video. Thank you.